Glasgow Coma Scale. The Glasgow Coma Scale is a 15-point scale for measuring decreases in consciousness. It is used for assessing and monitoring patients with an injury. The patient is assessed for 3 functions: opening the eyes, the ability to respond verbally, and the ability to move. A score is given for the highest level of function in each area. Then the scores are added up to make a total score. A patient with a score of 13 to 15 has a mild injury. A score of 9 to 12 indicates a moderate injury. A patient with a score of 8 or less likely has a severe injury. This patient does not respond at all. He has the lowest possible score of 3. First, test the patient's ability to open his eyes. The patient who is fully alert and opens his eyes spontaneously is given a 4. If the patient is sleeping or has his eyes closed, say to him, "Open your eyes." If he opens his eyes in response, he is given a 3. If he still does not respond, squeeze the trapezius, the muscle between his neck and shoulder. This should cause brief pain, but not injury. If he opens his eyes to pain, he is given a 2. If he does not open his eyes at all, he is given a 1. Next, test his verbal response. Ask simple questions. For example, "Do you know where you are right now?" If the patient answers normally, he is given a 5. If he answers but seems confused, like he's not fully aware of where he is given a 4. If he answers with random words that you can understand but don't make any sense, with responses completely unrelated to the question, he is given a 3. If the patient is making sounds instead of speaking words, he is given a 2. If he doesn't answer at all, he is given a 1. And last, test how the patient moves in response to your suggestion. Ask the patient to raise his arm. If he follows your request, he is given a 6. If he does not respond, squeeze the trapezius muscle between the neck and the shoulder. Then observe his response. If the patient makes attempts to stop the pain by reaching towards his neck and brings his hand above his clavicle, he is reacting to stop the pain. He is given 5 points. If the patient tries to withdraw or pull his arm away from you, and as he withdraws, he also flexes his arm, he is given 4 points. If the patient has abnormal posturing involving flexion, he is given 3 points. This is called decorticate posturing. The arms are held close to the body, the elbows are bent, the wrists are flexed, and the toes are pointed. If the patient has a different abnormal posturing involving extension, he is given 2 points. This is called decerebrate posturing. The patient appears rigid, his teeth are clenched, his head extended, his arms and legs are straight, and his toes are pointed in. The signs may be on both sides of the body or on only one side, or may be only in the upper limbs. If the patient does not respond to pain at all, he is given 1 point. Here is a real-life example. This man arrived with a head injury. In his first assessment, his eyes were open, but he was not alert. His eyes did not change with pain. He did not answer or make sounds. When his trapezius muscle was squeezed, he reacted to stop the pain by reaching toward his neck and bringing his hand above his clavicle. He had a coma score of 7, indicating a severe injury. The patient was given a dose of mannitol to lower the increased intracranial pressure. In the second assessment, 1 hour later, he opened his eyes spontaneously. He answered normally and obeyed the command. He had improved significantly with a normal coma score of 15. Remember, you can determine the severity of an injury by testing the patient's ability to open his eyes, to respond verbally, and to move.